Turning to the treatment of anaphylactic shock and anaphylaxis, always remember epi, epi, epi. Prompt treatment of anaphylaxis with epinephrine is going to lead to a much better prognosis. You need to treat the situation like you would other emergencies. Call 911, check the CABs. These used to be the ABCs: circulation, airway, and breathing. Administer CPR as necessary and help the person to stay calm. Also, be sure to get medical history and details in case the person loses consciousness before emergency personnel arrive. During the emergency treatment of anaphylaxis, there's things that are specific to anaphylactic shock that you're going to proceed to do. You're going to prevent further exposure to the allergen if possible. For example, if it's in response to a sting from a bee, then you go through the process of removing the bee sting. You're going to help the person to take any allergy medication that they have available, something like an EpiPen. Don't give any oral medication if the person is having difficulty breathing. Patients that have a known severe allergy are encouraged to have an EpiPen on hand wherever they go. This is an epinephrine auto-injector. This is an IM injection administered mid-thigh. Take the time to confirm which end has the needle when using an auto-injector like this. Turning the EpiPen the wrong direction is a common mistake, and it can cause you, who would be a rescuer, to inject yourself instead, and now you have a medical emergency. The patient may require a second injection somewhere between 5 and 15 minutes later if the response is insufficient after the first injection. You also need to make sure to remember that just taking this allergy medication doesn't end the emergency, that this person still needs immediate treatment. The third big thing you're going to need to remember is to treat and prevent shock. So help the person lie down with elevated feet. If they're having a hard time breathing, don't use pillows. And as always, don't move a patient with a suspected injury that contraindicates movement, something like a neck injury. Be sure also to keep them warm with a coat or a blanket. Qualified emergency personnel may intubate through a tracheotomy if necessary and provide supplemental oxygen to assist with breathing. They may administer IV fluid and other medications to raise the patient's blood pressure. Prompt epinephrine administration will be a high priority if it hasn't already been given to the patient. Other medications that may be given include antihistamines like Benadryl, which helps with redness, itching, and swelling, corticosteroids like prednisone, which prevents biphasic anaphylaxis, and nebulizer bronchodilators, which help with breathing. The patient should be monitored for something between 4 and 24 hours to observe for biphasic anaphylaxis. The episode itself may start and end quickly, but the follow-up and prevention of repeat occurrences is a long-term affair for these patients. Many treatments are aimed towards lowering severity and accelerating treatment of future episodes. First of all, the patient needs to know about how to avoid future contact with the allergen. Providing them with education along those lines is important. Some patients don't know what caused an initial allergic reaction. Frequently, allergy testing must be done to confirm the cause of the anaphylactic episode. Helping to create an awareness of potential cross-reaction allergies is important. These are common with nuts and with medications. For example, a patient who's allergic to peanuts has a high probability of being allergic to other nuts. Letting them know to watch out for that can be helpful. Not only the patient themselves, but their family as well, or anyone else that can be close to them. A parent, a teacher, or a spouse may be the person that would need to provide care and help prevent future exposure. Once again, epinephrine. Providing an EpiPen for the patient to take everywhere they go. It's fairly common practice to even prescribe 2 or 3 EpiPens so that the patient can have one in the car, one at school, one at home, so that no matter where they're at, they have this essential tool on hand to help provide those better outcomes. Be sure to provide that education about how to use it if we as healthcare providers are apt to make mistakes in administering with an EpiPen. Then you can imagine how much more so that's true with patients. There's also the option for patients to pursue desensitization. A course of treatments can take years, but it can lessen the severity with future exposure events to the allergen. So more on epinephrine. I wanted to end on that, specifically The main route for epinephrine is going to be intramuscular mid-thigh in areas where patients may be under a lot higher observation, like in ICUs. Then you may see epinephrine IV as well. Subcutaneous administration of epinephrine has fallen out of favor, mostly because, as you can imagine, you need good venous return to get that medication out through the rest of your body, which you're not going to get when the patient's in shock with a subcutaneous injection. Also note that there are different concentrations of epinephrine. Remember that this is also used for codes that, given through these different routes, then it's going to have different concentrations. So be careful, be aware. Know that it doesn't always work well when the patient has been taking beta blockers, something like metoprolol. Just always remember our number one rule with treatment for anaphylaxis: give epi, give it early. Early epi administration is associated with better outcomes, and even if all they have on hand is expired epinephrine, that's going to be better than no epi at all. I hope you enjoyed this presentation about anaphylaxis and anaphylactic shock. Be sure to leave comments and help me to know how I can make my presentations better in the future.